Hi, I'm Seb, and I'm here to talk to you about one of my recent cases. Now, this is a really important case that I've done recently that absolutely transformed the patient's smile. She came in because she had a few broken down teeth, some of her old crowns and bridges had fractured, and she has a few gaps in her top teeth. So we talked through the normal process of seeing the hygienist to get the gums nice and healthy first, doing a digital design of the teeth to get the positions right, doing a trial smile and a wax up to make sure she was happy with the final result before we even started. And then over a process of about 6 to 8 weeks, we slowly rebuilt her current teeth. We did some gum surgery on her front 2 teeth to help get the proportions correct. We used temporaries to help sculpt the gums, and then we managed to deliver the final smile using composite and porcelain veneers on the front teeth and some bridges on the back teeth. And the patient was absolutely overjoyed with the final result, and hopefully it's built back her confidence.